Hi, thanks for coming today. My name is Brian Lau, and sometimes I present with these AAC webinars with Matt Callison, but he wasn't able to make it today, and I'll be presenting solo. But this is something I'm going to be presenting a little bit more of an expanded view on at the Pacific Sports and Orthopedic Acupuncture Symposium, which, if you're watching this live, is coming up in spring, but you might be seeing this later. It'll be an ongoing event, so maybe check it out another time. So this is a little sample of that, and I'm going to be expanding on it quite a bit at that symposium. So what I'm going to be looking at today is specifically treating patients who work at a desk. But this is really looking at more movement-oriented aspects of the channels, looking at the movement from a channel perspective. So while sitting, if we're in a static position, it's not really moving, but it kind of is moving because we're holding a position. So we'll be looking at movement, corrective exercises, and some other things to be able to recognize patterns in patients when you're looking at it from a channel perspective. So we have this nice image in the beginning title slide, and I took this from the internet, and I kind of liked it because it says bad posture. And I guess it's not great posture. That could definitely cause strain. We'll talk about this a little bit more in a second. But I generally don't think anything is a bad posture. There's positions that have a use. And that particular position, if somebody was crouching over and had to look up, it's a fine position. But if we're going to hold that for a prolonged period of time, it becomes problematic, and it can definitely lead to pain. So I don't really like to think about good posture or bad posture. I like to think of movement potential and the ability to move in and out of a particular position and to move in and out of that position with ease. So that's a little bit more of the take we'll be looking at, and we'll go through some specifics on that. So let's jump right in. So first of all, prolonged sitting puts a strain on the body, especially if the patient sits with poor posture. Yes, I just said that maybe nothing's could be totally bad posture, but if they're sitting in a position that's collapsed, that's putting pressure on the organs, that's putting pressure on the joints for a prolonged period of time, that's going to lead to problems. And this is the frequent position the patients will sit in, is they'll have their back and shoulders rounded. So you could say scapular protraction would be there, and their heads are forward. The myofascia of the back is not engaged and it's locked long. So things like the lower trapezius, the erector spinae in certain regions, those are all going to be in a locked long position, and they're failing to sort of bring the body back into extension. And then the other key point is that the core is not going to be stabilized. So we'll be looking at that from a movement perspective here in a second, but that's going to be the general thing that you're seeing with people. You know, they get tired, they're there at the desk for a long time, things start to sag and slouch. So when they do that for a prolonged period of time, that can lead to many injuries that obviously all of us see in our clinical practices. So these will be things like muscle tension headaches. You can see, especially the younger kid in the bottom picture, a great picture. That's not staged. That was a camera that was on particular people, and these were just live action shots that they got. So you can see how much capital extension that younger kid has, and how much tension that's going to put on things like the suboccipitals and the cervical muscles that can refer into the head and create very much of a tension type headache pattern. So tension headaches are going to be a massive one that's going to be pretty prevalent with office workers. Thoracic outlet syndrome is the scalene shorten and the pec minor shorten. That's going to have a potential for entrapment sites for the brachial plexus, and then they're going to have symptoms down into the arms. Rotator cuff tendinopathies, it's putting the shoulder in a bad position, and especially with activity, that's going to tend to put more strain and wear and tear on the shoulder. Periscapular pain, both the cervical facets, muscles like levator scapula, other things can refer into that periscapular region, so that's going to be a common complaint. And all of that's going to put a lot of undue stress on the cervical joints and lead to premature or increase the chances of degeneration for degenerative disc disease, and that can lead to a whole host of other problems. So it's a massive problem. Many of our patients are office workers. They sit for prolonged periods of time on the desk. So it's really important to be able to have a good working knowledge to be able to help them come out of those patterns. And we'll look at some acupuncture ideas, but I want to start with looking at it a little bit more from a movement standpoint, because I think this is something that we can really increase our effectiveness if we can give them some movement re-education. So just a little bit of something I've been working on, especially starting just a little bit before COVID. And then all of a sudden I had a little bit more time when I had my practice closed for a little bit. Didn't have it closed too long, but that sort of allowed me to really start getting into my own training. And as I was getting into a lot more movement training, I have a pretty extensive background with Qigong and Tai Chi and some martial arts. But I started doing a lot of body weight calisthenics and just something I was really interested in when I was younger. I used to be a wrestler, and wrestlers have a lot of similar training where we use a lot of body weight type, climbing rope and pull-ups and a lot of other body weight type stuff. You're obviously, if you're wrestling, you're using a lot of other people's body weight as you're doing competition. So it's something I was really interested in when I was younger, and I kind of started coming back into it in my, I guess this is just before my 50s, and really enjoyed it. But since I'm an anatomist and since I'm looking at the channels a lot, especially the Channel Sinews, and thinking about movement quite a bit as I'm doing all these exercises, I'm kind of going over in my head, well, what channel am I working with? How is this organizing between channels? So it's just something that's really taken a hold with me, and I've been really looking a lot more at developing a system for understanding movement through the perspective of the Channel Sinews. And generally, most of the movement that we're going to be looking at is going to fall under one of three categories. And these will be the Tai Yang and Xiao Yin channels. So movements that are organized around those, that's primarily what we're going to be looking at today. So we'll come back and talk about that one. But that's going to be primarily extension type movements, and we'll add to it a little bit in a second. Xiao Yang and Jui Yin, so the Xiao Yang and Jui Yin channels. So these will be actually one of two things that are correlated, either side bending type motions or stabilization. So when we're walking and moving, we're stabilizing from our sides and preventing excess movement. So that would be part of it, or just literally like side bending type motions. And also rotational type movements. Maybe another webinar, we can go into a little more detail of how those are correlated through the joints, through the pelvic joints. But for now, we'll just keep it simple, side bending and rotation. And then Yang Ming Tai Yin based patterns, much more flexion oriented type positions. So we can look at the movements from the channels and design very health giving, a type of Qigong, I guess, movements that are organized through the Channel Sinews. These movements can open fascial planes, mobilize joints, and mobilize and massage the organs. So looking at the movement of the organs and the movement potential of the organs, those channels actually take the organs into a movement. So kind of briefly going back to Xiao Yang, Jui Yin, the liver itself has a rotational type movement where it rotates around the inferior vena cava. So any type of rotational movements also mobilizing the liver. Side bending, the liver has a side bending type motion where it kind of moves and side bends. So any side bending type of movement will also mobilize and move the liver. So understanding the Channel Sinews and their movement actually gives a little window into understanding how to self-mobilize the organs through movement, which is really a lot of what Qigong and those types of exercise systems are about. But we can just look at it a little bit more with a modern lens. So let's go today into the Taiyang Xiao Yin patterns. So this would be urinary bladder, small intestine. I know everyone knows this, or at least if you're an acupuncturist, you know this. So urinary bladder, small intestine, kidney, and heart. We'll be focusing a little bit more on the urinary bladder kidney portion. But these movement patterns engage the back and the core lines. So those are going to be a big part of it. The general movements involve hip and spine extensions. So they're things that lift us and bring us upright into the world. So extension would be the big part of it. Spine and hip extension, scapular depression. So they help pull the scapulas down. Again, this aspect of lifting us up into the world. So very open and upright and present in the world. We're going to have external rotation, especially the small intestine sinew channel, and extension. So shoulder external rotation, extension, elbow extension, all of this with a very stable core. because as you're going into extension, it's easy if those muscles in the back are in the urinary bladder channel and small intestine channel are too overactive in some respects. They can overextend us. So we need the stability of things like the transverse abdominis to keep us stable. So there's a nice relationship between how the back and the front work, especially via the kidney and the urinary bladder channel. Both of them to give us this sort of extension, this nice expanded spine, and nice upright posture that's really prevalent in much activity we do, and sometimes becomes less prevalent when we're sitting and starting to fall and kind of collapse a little bit. So these would be active even sitting, and just to keep us upright and keep us in a really good decompressed position of the spine. So the movements are going to include things like stacking the spine and pelvis, stabilization of the shoulder girdle, and engagement of the core. So I have a little video here that you could use this for an exercise for office workers. It's not the main one I'm going to be showing for today, but just to highlight some of these features. It's kind of a front lever progression. So a front lever would be if I were holding onto the bar and making myself completely horizontal with the ground, something I'm not able to do, working towards it. Maybe in the next year, come back and we'll see how I'm doing on that. But it's a very difficult exercise. So it takes a lot of strength in the back, a lot of strength in the core. But this would be an easier way to do it. You can see being at a much less angle where I'm more upright, still at an angle. I have to extend the back to be able to get upright. I have to externally rotate the shoulders. I have to pull down with the lats, and I have to stabilize with the core. And I think you can see all of that a little bit better with the actual movement. So I'm going to play the video. This is a pretty short video, about a minute.
The very first thing I'm going to do is relax the arms. So they become passive. Shoulders go into protraction. I become rounded in the back. Then I'm going to start to let that relax all the way down the back. I'm not sticking my behind out. I'm just letting the spine stretch and drop until I'm underneath the band, passively hanging. Then when I'm ready, I'm going to start to push up, pull into the band, engage the lats, engage the lower trapezius, engage the core, return to that straight line.
All right, so that's a very nice exercise because it kind of massages the spine and basically going into a lengthened position in the urinary bladder, small intestine channels, and then the stand-up portion is where I start to engage those structures. So I engage them from a position where they're already lengthened and pretty decent full length position, and then engage them from that position to come back to an upright posture. So I sometimes use that as a nice warm-up exercise and just to kind of inform and give information to the channels before doing something that might be more strenuous. Like if I'm trying to do the front lever, working with that and putting more strain in the body, I like to have a good warm-up to where I start to inform the body of what muscles are activating and how is the body organizing those movement between the channels. You don't have to think about it so heady, but just how does the body organizing that movement before I go into something that's a little bit more difficult. But that is a really nice exercise by itself for people who are in offices. If you have a setup for something like that, it can be really nice. But I'll show one that's maybe a little bit more accessible in the office. So let's briefly go over some channel information. So as all of us know, the urinary bladder channel moves down, starts at the brow and travels down to the foot. But how about the sinew channel? So the sinew channel, we kind of already saw it a little bit with this previous video. The sinew channel tends to pull downward to create an upright posture. I really like this image on the right, which is from an out-of-print book from an anatomist, John Hall Grundy, who Tom Myers, if you've ever studied with him, really likes this book quite a bit and uses some of his images. I think his images are great. They're very thoughtful. He gives just these dissection images sometimes. This one's more of a schematic, that kind of shows the body from a different perspective that helps us understand something about the body. And this one's kind of showing that aspect of those erector spinae almost like a pulley. And what they're doing is they're pulling to bring us upright. Yeah, maybe they can get too tight in areas and over pull, but they're just like this, those hands on the ropes are just kind of lifting us up. They're lifting us up from the back to lift the front upwards. So the downward pull in the back lifts us upwards in the front. Very, very good representation of the urinary bladder sinew channel. So we would have that capacity at things like the lower trapezius. Let's see if I can get my cursor on here. So the lower trapezius is going to pull down on the scapula to help lift and open the chest. The erector spinae is going to pull on the spine to help us come out of flexion and into extension. Glute maximus is going to help us kind of prevent us from going too much into an anterior tilt of the pelvis. So it's going to drop the pelvis down and keep the pelvis in a good neutral position. So when it gets weak and inhibited, sometimes people will then go into more of an anterior tilt to the pelvis and put strain on the back. So it helps stabilize the back, stabilize the SI joint. Muscles like the lateral portion of the leg here, this lateral branch of the UB channel on the bottom left, which I interpret as the peroneus longus and brevis. Those help, or if they get too short, let me say it that way, if they get too short and lift excessively, they'll collapse the foot into the medial arch. So we have a technique that we show, and we have this on our YouTube channel, where we pull those down, kind of descend, help those proprioceptors understand they don't need to be so excessively lifted. They can drop down to help take away that dropping into the medial arch. And then we'll combine it with a lifting technique on the medial arch at things like kidney 2, which is the abductor hallucis motor point. So I was going to put that into my presentation. I wasn't sure if I'd have time, but that is on our channel. I decided not to put it in there. Not relevant necessarily to office workers specifically, but just to understand that downward aspect of the channel and how the channel in pathology sometimes can excessively lift. Right, so the kidney channel moves up and stabilizes. So when we start looking at the channel sinews, we have structures like in the front of the spine, the psoas major, the anterior longitudinal ligament, a big stabilization of the spine in the front of the spine, and then this portion at the neck, up at the top of the spine there on the image on the right, would be the longus colli and longus capitis. Those are very important for stabilization of the neck. So when those get weak and inhibited, the neck tends to kind of jut out. So they have a certain amount of ability to keep the neck in a nice upright kind of stacked position. The kidney channel also, if you look at the description in the Ling Shu of the sinew channel, it's pretty vague. You have to really start looking a lot at cadaver dissection and some research, fossil research. You have to bring a lot of things together, I think, to get a good understanding of what structures could be potentially part of the sinew channel. It's a work I've been doing for about the past 10 years. But it would be hard to find a description from the Ling Shu that talks about things like the transverse abdominis as part of the kidney sinew channel. But if you look at the channel system as a whole, the low connecting point does kind of talk about the core in a way, because this channel, this low connecting channel, travels up the abdomen following the kidney channel. Question I have is what depth? I think it's at the depth of the transverse abdominis. That goes to a point just below the pericardium. Well, if the transverse abdominis is part of those structures, it's going to blend in with the diaphragm pretty seamlessly. And then the heart sits right on top of the diaphragm. So that would technically go to a point just below the pericardium. And then those the multifidi connects also with the pelvic floor, but also, the transverse abdominis connects with the pelvic floor, but also the multifidi, these deep lumbar muscles that are stabilizing muscles of the spine. So I think the kidney low channel is really giving some kind of description, maybe not of the muscles, but of the ability for those muscles to stabilize. A big part of the kidney channel to stabilize the lumbar region, to support. And I think their description, their trajectory hints at these core stabilizing structures of the transverse abdominis, the pelvic floor, the diaphragm, and the lumbar multifidi. So in sports medicine acupuncture, we take those core structures and put them in the sinew channel just for ease. So the kidney sinew channel would include those core stabilizers of the spine, the psoas, which is also a core stabilizing muscle, at least a portion, the stabilizing the deeper fibers, the more superior fibers of the psoas, which are really stabilizing the spine, are part of the kidney channel. A little bit of a aspect of the QL also. All of these stabilizers of the spine really speak to the kidney channel and its lumbar and spinal stabilization role. But then also, like I said, up in the neck, we have those longus colli and capitis. So very much about stabilization. So collectively, the urinary bladder and the kidney sinew channel are looking at balancing the spine in a very easy way, or at least a simple way of looking at the spine, is to look at the curves of the spine. It's tricky when you start doing postural assessment. Is that right? Is that normal? So one thing you can look at is there a balance between these curves of the spine? And what these curves are is things like the cervical lordosis. That's in that picture is referred to as a secondary curve, meaning that it's not there at birth. As we start looking up into the world and put strain in the body, we start developing that secondary curve in the cervical spine. Primary curve in the thoracic spine, that's there at birth. We have just a C curve, so they call that a primary curve. And then same thing as we're crawling and moving and eventually stand up and walking, we start developing a secondary curve at the lumbar spine. So looking at that kind of curve of the spine can help us understand if there's a good balance between the urinary bladder and kidney channel, because we want a really good balance between those curves. We don't want all thoracic curve, or we don't want an excessive cervical lordosis or an excessive lumbar lordosis, or maybe a flattening of the lumbar lordosis. Some people naturally have less curvy of a spine. Some people have naturally more curvy of a spine. So you can start looking and seeing, is there a balance between those secondary and primary curves? Back to Tom Myers, whose work I've studied a little bit, he also extrapolates that out to the posterior knee, which isn't a spinal curve, but that's a normal. There should be a little bend, a little gentle lordosis, and if you want to call it that, in that posterior portion of the knee. But as you look at people, sometimes their knee becomes hyperextended, and so they've sort of lost that curve relationship, or even the arches of the feet. So you can take that idea of that balance of the curves all the way down the spine into the knees, into the feet, and the arches. So we want just a nice, even kind of ebb and flow in those curves of the spine. So I think you can agree, looking at those images of the desk sitters that were dropped, their balance was lost. They have a capital extension, a strong curve up at that upper part of the cervical spine, but everything is, the whole spine is incurved. They've lost a little bit of the lumbar curve. There's not a really good balance between those positions. So let's look at an exercise, and we'll talk acupuncture, and we'll also look at a myofascial release technique. Let's look at an exercise that is a little bit more accessible because people can do it in a chair. This is something you can work with them on. This is going to be a seated exercise. It's modified from a Qigong pattern, 8 pieces of brocade, for those who know it. This is the second move. It's 2 hands hold up the heavens, and it stacks the spine. That's going to be the first thing it does. But then it's also going to start moving in the frontal plane, so a side bending movement. The reason of that is because office workers, everything is moving forward or back. Maybe the neck's jutting backwards or forwards. Maybe the thoracic spine is sinking back, but everything's moving sort of away from that frontal plane. The head maybe moves away from the frontal plane. The back moves away from the frontal plane. Everything is in that front and back position. Maybe those people exercise, maybe they don't, but frequently when people exercise, everything's in that front and back position, like running, much of weightlifting, everything's flexion, extension, flexion, extension, flexion, extension. So most people, especially office workers, aren't doing enough movement in the frontal plane, like side bending motion. So this exercise is going to stack the spine, get a good balance in the spine, get a good stability in the core, engaging those back muscles, and then it's going to start going into a side bending motion to help bring in a different movement potential that they're not probably, or let's just say they're more than likely underutilizing. And that can really give a little tensional support from the side and help that elevation and lift coming up the body. So I'm going to go ahead and play that video.
Many of my patients sit for prolonged periods of time. In this position, the head is forward, the back muscles are under slack, and the core is not engaged. Prolonged times are spent with major parts of the spine moved forward or back. Let's look at a simple Qigong exercise that can be a mini break from sitting and help alleviate some of these issues. This Qigong pattern is one of the 8 movements in a system called the 8 Pieces of Brocade. This is a great Qigong exercise for office workers since it highlights the engagement of the back and core while performing a side-to-side movement. These are movements which are frequently absent when sitting, especially if the posture suffers. The exercise can be performed standing or seated. Here we see it standing, but we will look more detail at the seated version since it can be easily adapted to a work environment. Start by sitting upright on the sit bones or the ischial tuberosities. Roll off the back of the sit bones and round the back. Then roll back onto the sit bones, engage the back and core, and grow back to an upright position. Again, roll off the back of the sit bones and round the back. Roll back onto the sit bones, engage the back and core, grow to an upright position. Repeat the same movement, but this time rotate the arms and turn the palms up. Turn the palms down as you grow back to upright. Now let's look at the full movement. Roll down like before. Interlace the fingers. As you grow and expand, start to turn the palms towards the sky. Get the elbows lined up with the side of the body, reach upward, and maintain an open chest. Bend to the side, allowing the opposite side rib cage to open and the spine to curve. Keep both sit bones on the seat. Return to the midline and then repeat and stretch to the opposite side. Return to the midline, stretch up, then let everything relax down while bowing the spine. As the hands pass the solar plexus, grow, open the chest, engage the back and core. The entire movement can be repeated several times. At least 3 times would make a great little mini break and help bring back length and ease while sitting.
All right, so that's on my YouTube channel. It's Jingjin movement training. If you wanted to check that out, it goes through a practice run of it if you wanted to do it with the video, so that it gives you a chance to practice it. I think there's three repetitions of that. If you were to work with that with a patient, the whole movement's great because of that side bending aspect. Again, that's a movement that they don't often do. And everything that they are doing is forward and backward generally. So it's nice to have some tensional support put into the body from the side to help give tension, good tension, to give like stabilization, kind of like an old fashioned Boy Scout pup tent. You want a nice balanced pull in all of those wires that are giving the tent nice shape. So it's nice to have that little pull from the side. But if you didn't have the time, or maybe a patient wasn't super aware, starting with that rolling off the sit bones and letting the spine curve, and rolling back on the sit bones and letting the spine stack is a really great educational tool for the patient, because my general view, again, is that there's not a good or a bad position for the body. If I were to roll off the sit bones and curve, and I were reading a book and I had a book in my lap, that's not a bad position. I wouldn't want to be there all day, but it's a nice curve through the spine. It's a balanced curve. And if I roll back up on my sit bones and stack everything, I think that's a good position. Again, I wouldn't want to necessarily sit in that all day. I want to get up and move around a little bit. Where I think people run into the most trouble is when the spine is not working in a balanced position. Maybe they've rolled off the sit bones, they've collapsed the chest, but then they arch the head up. So part of the spine is in flexion, and then another part of the spine is making up all that difference in extension. And that position is where people, I think, tend to get into more trouble. It's fine for a momentary movement, but when you're holding that position, it's not a particularly comfortable position, puts a lot of strain on the neck and the shoulder girdle, and can lead to injuries. So I like that aspect of rolling up onto the sit bone so they can get that support under them from the pelvis, and finding that position of stacking the chest, bringing the head back, lining everything up. But you don't want them to go too far. You don't want them to roll off the front of the sit bones and hyperextend either. So it's just finding that balanced tone from the pelvis, torso, shoulder girdle, head. Everything is comfortable, balanced, and it's a much more injury-free position. So doing that, I think, is a better strategy than trying to dictate to somebody how to sit and pull the shoulders back and everything becomes very stiff. Finding that relationship of how the pelvis stacks on the chair and everything else stacks above it is a really great tool. Acupuncture can be very useful obviously for a lot of these injuries. So if we're looking at acupuncture, we have to specify really what they're coming in for. So a lot of the local based injuries are going to be more specific treatments for those. I'm not going to get into that because there's a whole host of them. Learning how to treat and recognize those particular injuries can be very useful in guiding that. But just some general guidelines for distal points. If people are in that position for a long period of time and they're not engaging the back, those back muscles tend to get inhibited and they have a hard time finding those muscles that help depress the scapula, externally rotate the shoulder girdle, stack the spine. So UB64, SI4 is really a wonderful combination, both of them being source points to help build channel chi, to help sort of inform the channels and give a little bit of energy to the channels to help them find those muscles and engage those muscles more effectively. So UB64, SI4 are really a great treatment. UB60, SI3, obviously a lot of people use that combination if they're acupuncturists. UB60, as many people know, is really working on that excess yang that rises up the channels. So there's people who have their ears up against their shoulders up against their ears, everything tenses and that channel rises excessively. That, especially if it's much more of like a tension, stress, high-end type thing, is a really great point to help descend that chi down the channel. SI3 obviously used for a lot of neck pain. So those are great combinations for those people who have a lot of excess rising of the back of the body and leading to things like tension headaches. Kidney 4, the low connecting point of the kidney channel, can really help engage the core structures if they have a very weak and inhibited core, like transverse abdominis, pelvic floor, that kind of stuff. And then working with local motor points for things like the rhomboids, upper and middle trapezius, and the chest muscles to help balance the front and the back can be a great strategy. So last thing we're going to look at today is the myofascial technique that'll help stack the spine and descend the channel in the back, descend the urinary bladder channel. So this is a technique we teach at Sports Medicine Acupuncture Program. And I have this one up on my YouTube channel, Jingjin Movement Training. There's a similar table technique to this on the Sports Medicine Acupuncture YouTube channel.
Let's look at a myofascial technique where we spread down the urinary bladder jingjin, especially concentrating on the erector spinae muscle group. We will have the patient roll forward, vertebra by vertebra. While they are actively flexing the spine, we will spread through the tissue to soften and lengthen any areas where the erector spinae are bunched. So you can do this with both hands simultaneously or one hand at a time. Both hands is nice, but sometimes it's good to guide the patient by working on one side while you're assisting them. It depends on their ability to do this well. First thing they're going to do is make sure they're solid in their feet. They can even give a little small push back into their feet so that they can support against your pressure. Now let the head go, and she's just pulling me through the erector spinae. So I'm lengthening, I'm looking for balanced movement. Okay, let the left shoulder go, that's good. You can just go straight down. So with women, you're going to have to readjust around the bra straps. There you go, stop for a moment. So when they stop, you're going to sink back in and then have them go into flexion as you spread through the erector spinae. Arms relax. And hold. Stop for a moment. Sink back in. And then have them continue down into flexion, the whole time being supported in the feet. Let the left shoulder go a bit. There you go. Good. And now continue to drop. And you're spreading through the erector spinae now into the lumbar region. All right, now you can help them as they stack. So behind settles first. A little bit more weight here. There you go. A little bit more. A lot of people want to come up instantly with the head. I'm going to do this incorrectly for a second. A lot of people want to come up here first, but we want them to stack first and get the support. Stack, chest up, and they're in a neutral position.
Great. So that's a bench work technique that's very common in structural integration. It's the type of work I did before as an acupuncturist. Rolfing's a type of structural integration. We do a ton of bench work. I really like it because the patients are actively engaged and they're able to kind of inform the body, by that movement of stacking, in this case, stacking the spine. If you do go to my YouTube channel at Jingjin Movement Training and watch that particular video, I'll give you something to look for. She had a hard time stacking her lumbar spine. And I kind of wish I would have pointed it out on the video. I kind of noticed it when I was demonstrating the technique, but I didn't want to take the time there. But as she goes to stack the body, she has a very difficult time coming out of flexion with the lumbar spine and kind of then misses it and comes up above it. And she has a tendency to have, like a lot of people who are very athletic, she has a pretty notable anterior tilt to the pelvis. So maybe a little more time spreading through that lumbar region, a little bit more time stacking would have been indicated. But I was just doing it as a demo. But anyway, something to sharpen your eyes. You can look and see, because what we want to see is that each vertebral level moves apart one by one, and that each one then stacks from the bottom. So that's kind of part of that training of the UB Jingjin, to kind of get that stacking and get that upright posture so that then people can feel comfortable in their seated position. So thank you to American Acupuncture Council for having me for this webinar. It's been very nice presenting on some of these ideas. These are, like I said, things that we teach within the sports medicine acupuncture program, especially in the one of the classes that I helped co-develop, the class that's looking at assessment and treatment for the Channel Sinews. So check that out if you get a chance. You can also, like I said, check out those YouTube channels, and hope to see you guys again. So thanks again to American Acupuncture Council.